Gastroenteritis. To understand what it is, let's break up the word into its parts. Gastro means stomach, enter refers to the small intestine, and itis refers to inflammation. Hence, gastroenteritis is the inflammation of the gastrointestinal tract. There are two types of gastroenteritis, acute and chronic. Acute meaning it doesn't last very long, from a few days to a week, and chronic gastroenteritis lasts a long time. Most cases of gastroenteritis are acute cases, though while it doesn't last very long, it can be quite serious for infants and babies to develop. Gastroenteritis, more commonly known as gastro, is contagious and will spread quickly if proper hygiene is not followed. Gastro prevents the absorption of nutrients and water into the body, hence the body must expel this water and food, which is achieved through diarrhea and vomiting. Though as the body is not absorbing any water, a person with gastro will become dehydrated. People with gastroenteritis have a reduced appetite, hence will experience muscle weakness and a lack of energy. Other symptoms include abdominal pain, fever, nausea, and headache, all of which are caused by the inflammation of the intestinal tract and the inability to absorb both nutrients and water. The severity of symptoms and duration is dependent upon the pathogen causing the gastroenteritis in the person. Gastroenteritis is usually caused by fecal to oral transmission. This means the bacteria, parasites, and/or viruses are contaminating fecal matter, or poo. People who have gastroenteritis may spread the pathogen by poorly washing their hands and then contaminating other people directly, or by touching other surfaces. If pathogens enter a person's mouth, they will contract gastroenteritis. Once the pathogen is within the gastrointestinal tract, it will cause damage to the epithelial cells which line the gastrointestinal wall, preventing the absorption of food and water into the small intestine. Therefore, the person will become sick. Bacterial causes of gastro include E. coli, Staphylococcus, and Salmonella. Viral causes include rotavirus, norovirus, and astrovirus. Parasitic causes include Giardia lamblia and Entamoeba histologica. Though it is possible to be acquired from viruses, parasites, and bacteria, most cases of gastroenteritis are from viruses and bacteria. As the largest cause of symptoms is dehydration, it is important to stay hydrated. For children, it is important to give them many small sips of water or electrolytes to avoid dehydration. Icy poles and ice blocks also work effectively at maintaining hydration. In the rare case of chronic gastroenteritis, some patients are given intravenous therapy in hospital in the form of a continual transfusion. This ensures the patients are receiving all vital liquids and nutrients gradually. The best means for treating an illness is to not contract it. Hence, it is most important for parents and caregivers to educate children on proper hygiene and means of preventing the spread of disease. Due to the lack of understanding and proper hand-washing techniques and personal hygiene, children are most susceptible to illness which travels via fecal to oral transmission. Teaching children to wash their hands after going to the toilet using soap and water is very important. Ensure that people with gastro do not prepare food for you or others, as they may contaminate it. Take care when eating food prepared in other countries, as all countries have different rules and laws concerning food and food handling. While a child is ill with gastroenteritis, they should not be taken to school and should remain home for 2 days, or until the child has significantly reduced symptoms if recovery takes more than 2 days. When symptoms are first noticed, the child should be taken to see a doctor. A doctor can perform tests to determine the cause of the gastro. Usually this is in the form of a stool test or a blood sample. Depending on the cause and therefore severity of the gastro, a specialized treatment will be recommended. For untreated chronic gastroenteritis, it is possible the child may need to be taken to hospital.